Hello, everyone, and thank you for joining us for the SMI Welcome Orientation. My name is Emily, and I am the Senior SMI Services Coordinator here at Mercy Care. I will be providing an overview of Mercy Care's SMI network of care, an array of supportive services available to you, to families and caregivers, through health homes serving those designated with a serious mental illness, also referred to as SMI. What is a RBHA health home? A health home is a location where you get services like case management, psychiatric appointments, and rehabilitation services. The health home is a location that works as a hub for services. Health homes are located throughout the Valley and are operated by various providers in the network. There are currently 34 RBHA health homes in our network. Who will you find at the health home? Site administrators, clinical directors, office manager, psychiatrists, nurses, clinical coordinators, case managers, rehabilitation specialists, peer and family supports, office assistants, and ACT team medical staff and specialists. Site administrators and clinical directors sometimes have different names at different locations, such as program manager, but they still have the same roles and functions. What is the morning meeting? Every team has a morning meeting to review schedules and other needs for the day based on the needs of the member from their team. What is the caseload? The size of a case manager or ACT specialist's member list. The size is based on a level of care those members need. Some of those needs may include face-to-face contact, home visits, doctor visits at the health home unless ACT, and nurse visits at the health home unless ACT. What is happening behind the scenes to help you in your recovery? Schedules, contacts, home visits, hospital visits, crisis, outreach, treatment planning, and referrals. Blue dot and red dot. Health homes are busy places with a lot of activities and moving parts. If the case manager is out and a member or family member needs assistance, a person identified as the blue dot is a case manager level staff member who can provide assistance in the absence of the assigned case manager. The person identified as the red dot is a supervisor level that is available to assist at a supervisor level should the needs be escalated. The clinical director and site administrator provide oversight for the entire health home. Levels of care. Assertive community treatment, also known as ACT. This is an evidence-based practice focusing on service delivery versus case management. About 10% of the members receive this level of care. These individuals have the highest contact need, with an average of 4 face-to-face visits a week. Supportive. Approximately 80% of members receive this level of care. Face-to-face contact every 30 days at minimum, and home visits at least every 90 days. Connective. Approximately 10% of members receive this level of care. Face-to-face contact every 90 days, and a home visit at least once a year. Lastly, as navigator, this is a newer level of care that was added in January 2017. This level was developed to assign members with an SMI designation to a RBHA health home. What is a clinical team? The clinical team, or adult recovery team, is a group of behavioral health professionals who work with you to provide the best care and services to meet your needs. You are the primary member of the team, and without you and your involvement in the process, things would not go as well. Your family, friends, or family of choice are all part of your team too, if you wish. It is always best to have those that love you involved to support you. Who is on a supportive team and connective team along with you and your loved one? The clinical coordinator oversees each individual clinical team. There are also psychiatrists, a nurse, rehabilitation specialists, case managers, about 7 to 8 per team with 1 designated to each member, and peer and family support. Integrated health. Mercy Care's model for integrated care for members with serious mental illness. The integrated health home model combines behavioral health and physical health services, so you will receive all services at the same location. Integrated care and member perspective. Community and social support, primary care, behavioral health, and specialty care, employment support, and peer support. Some of the core elements of the integrated health home model include whole health care, a person-centered approach, team-based care, care coordination, evidence-based programming, interdisciplinary care plan, training for providers, evaluation and monitoring, population health approach, and use of technology. Here is a list of the current integrated health homes. Virtual integrated health model. This is a teamlet model developed by Dr. Thomas Bodenheimer and colleagues in California. The embedded health coach is essentially the bridge between your behavioral health home and physical health provider. This is a virtual integrated care approach where members receive care at 2 different locations, the behavioral health home and the primary care practice. Integrated care plan implementation is also present. Here's a list of the virtual health home providers. Assertive Community Treatment, or ACT. ACT is a level of care for members designated as SMI. Members meet specific criteria before they're determined appropriate for this level of care. It's a voluntary program and may be within a health home or a location that holds only the ACT team. Who are the staff on an ACT team? Psychiatrist, 2 nurses, clinical coordinator, independent living specialist, housing specialist, rehabilitation specialist, employment specialist, 2 substance abuse specialists, peer support specialist, ACT specialist, and program assistant. Here are the list of the 24 ACT teams in our network. First episode psychosis. There are 2 providers, Valleywise First Episode Center and Resilient Health Epicenter. Some of the services include counseling, individual and group, medication, family support and education, supported employment and education, and case management at Valleywise. Valleywise First Episode Center is a health home where you will receive all health home services, while Resilient Health Epicenter will provide all FEP services, but you will receive case management at your assigned health home. You must first meet criteria for first episode psychosis before being accepted into services, and FEP providers serve any population between the ages of 15 and 35. Mercy Care has some additional resources for members and families. If you have any questions, please contact Mercy Care Member Services or visit our website at mercycareaz.org. Thank you so much for joining us today.